Hey guys, so my name is Dina BenDavid. If you follow me on Instagram, you may know me as the Divine Doc. I am a nurse practitioner and I am the owner and founder of Divine Beauty and Wellness, which is a full service medical spa on Martha's Vineyard Island, which is off the coast of Cape Cod in Massachusetts. I'm also the one of the lead KOLs with PDO Max and travel across the country and soon to be internationally. To train providers on PDO Threads. So I was invited today, really excited by Aesthetic Next to talk a little bit about how threads can change your practice, a little bit about sort of the foundation about threads and some of the newer things that we are seeing and that we're able to do with threads. So I'm going to dive right in, and I wanted to just kind of talk a little bit. I know a lot of you guys probably know about threads, have heard about threads. If you haven't personally used them, you know you have colleagues that have, or at the very least have seen or kind of just heard, maybe people asking about it. So I just kind of want to talk a little bit foundation stuff before I move into the demos. Okay, so what is PDO? PDO stands for polydioxanone. People call it PDO because no one can pronounce it correctly. It took me about a year. No, I'm just kidding. Probably about a year to pronounce it. Anyway, so PDO, so what is it? It's a synthetic monofilament fiber consisting of one solid fiber of thread. What happens is it absorbs in about 4 to 6 months, give or take, once it's placed in the skin. And what happens is how I describe it to patients, to be very simply, is if you pretend like this is a thread that we place into your skin, what happens is, and the reason, and this is important to talk to patients because people think, oh, this thing's gone in 4 months, so why am I going to bother doing this? The effects are much longer lasting. And why? Because your body's going to form collagen 360 degrees around the thread. Okay? So once the thread itself is gone, the collagen your body naturally produced will take over for the job that the thread was doing. So that's why we're getting results that are much longer lasting than the thread lasts in the skin, if that makes any sense. That's kind of, I found a great way to explain that to patients. It has been used in surgeries for decades, okay? It's a very inert substance. Your body will naturally break that down over time. It's even used, and not to sound really morbid, but I say this so people understand that it is a very safe substance your body will break down. It's even used in neonatal cardiac surgery, okay? In other words, very, very safe. And they're absorbed by a process called hydrolysis, where H2O and CO2 are released in this mildly exothermic reaction. I don't want to get too technical for you guys, but I think it is important for us to understand a little bit of the physics and the chemistry behind like how this works and why it works, because we're placing them, right? So not that we need to tell patients this stuff, but I do think it's important, obviously, for us to understand a little bit about this stuff. So again, breaks down approximately 6 months, could be a little bit more, could be a little bit less after we place them. We're going to talk about barb threads and we're going to talk about smooth threads, okay? Barb threads are also known as lifting threads. So those are the threads, the longer threads that you see us placing to help reposition tissue. Okay, that's their main purpose, or contour tissue. Then there's smooth threads. They're also known as sharp threads. Some companies refer to them as mono threads. Their main purpose is to essentially induce collagen. So typically for smooth threads, we are placing those in usually a scaffold pattern or a certain pattern just to help tighten the tissue and to help improve the integrity of the skin over time, okay? But barb threads are the ones that we're using when we are trying to lift the mid-face, kind of crisp the jawline, raise the brows. Those longer threads that you see, the more uncomfortable placement ones, those are typically the barb or the lifting threads. Okay, we numb patients prior to the procedure. Some providers, most people don't, I'll just say the numbing creams typically don't really do much. I would recommend injecting lidocaine. I prefer cutting mine with a little bit of bicarb to help minimize on some of the burning sensation, but everyone is a little bit different. So a cool thing about PDO threads is they literally can be placed almost anywhere in the face, neck, body, wherever. Anywhere where you want to improve the texture, quality of the skin, anywhere you want to kind of lift and reposition the skin. It's pretty awesome. Face, again, brows, we can do the under eye. There's special amazing threads that we can use to improve the under eye area without having to use filler. Mid face, we can do nose, there's special threads that we can use in the nose to help narrow the bridge, to help narrow the ala here, to help raise the tip. Pretty awesome. We can put threads in the lip if someone doesn't want a substantial volume but does want to crisp that border up, and just for minimal volume, it's great for that. Jawline, neck, arms, belly, legs, the skin above the knee. They're pretty incredible. They're very versatile. Love them. In full disclosure, I am a KOL and a trainer, as I said, with PDO Max. So I just want to fully disclose that, although I'm not being paid by the company today to endorse them by any means. I do want to point out that something very important that I actually never knew prior to really doing a little bit of digging and research and talking to some of these companies and the FDA is understanding that not all companies that are selling these products are actually FDA cleared or approved. So there are currently, as of today, only 2 thread companies that are in fact FDA cleared for their PDO thread in cannula. There's 2, okay? One of which is PDO Max, the company that I represent, and Miraku, okay? So those are the 2 currently that have K numbers. I will tell you that all companies, not all companies are honest. They may tell you they are, but are not able to produce an actual K number. So I would recommend, just to do your due diligence to be able to find that approval or the clearance certificate. Don't always listen to what you're, told by the company reps, because they're unfortunately not always honest and ethical. And if you have any questions, to call your FDA office to ensure, because obviously we have licenses to protect, and that is first and foremost, in my opinion, to not only protect our licenses, but to ensure that we are using products that have, proven safety profiles. But what we're gonna do, I think for the model that I have today, and just for purposes of, I don't have that much time, but I did wanna kind of show a demo of some of the most common areas that we're seeing mainly right now. And that is kind of to help chisel the cheek here, and definitely the area, the eyebrow area, especially the lateral brow here that we're seeing a lot of the younger clients coming in is something that we're seeing a lot of. So definitely want to demonstrate some of those today, and perhaps I can get someone else to also demonstrate some of the lip as well. That would be a good one to show you guys. Difficult for everyone to see from this angle. However, this vector that we just placed it in, it was a very short one. It really helped minimize on this deep nasolabial fold, the superior aspect here, that was really concerning to her. You can kind of see where we're really pushing back that the fat pad back up here in the infraorbital region. Okay, so the vector, this first vector here that I placed, this top thread in, this 19-gauge thread, the way that I placed it was such where it really eliminates this heaviness on the superior aspect of the nasolabial fold, and will likely avoid us having to put any filler into piriform fossa. And as I don't know if you guys can see on this perspective here, but when we pull up on that, you can really see how beautifully this lifts up this cheek region, and this fat pad kind of pops up the area under her eye. It's going to look beautiful. So you turn your head like this. so beautiful. Oh my God, this is gonna look so good. But if you can see how much beautifully lifted this side is here, even along your jawline, because one of the threads can be placed down here, and how much more minimized this is. Isn't that crazy?
It's amazing.
So sorry you had to see your face when they're taking out.
No, but I can feel it. Like, I can feel that, like, it feels snatched.
Yeah.
You know what I mean?
Yeah. Millennial word is snatched now with the thread game. Isn't that crazy?
Wow.
Right?
So worth it.
And and a lot of these younger girls, such as here, this gal here, they're looking for that snatched appearance, right? They're looking to have, they obviously don't have any substantial laxity, really no doubling or anything of that sort. They just want this cheek, they just want that popped up ever so slightly. They want to kind of have a little bit more angular of a jawline, but they really want to kind of have a little bit of a cheek pop, as well as their lateral brow lifted, which we can do for you in a second. As soon as you finish your other side. All right, that's cool. So I like to personally leave my threads in until I'm kind of done placing where I want them. And sometimes I go back in and place more, but I'm able to kind of manipulate the tissue a little bit better when I get them placed in the vectors that I know that I want them for the best lifting effect. And then I'm able to kind of contour a little bit more, and if I need to place some more, and I can do that. I just find the end result is much better if I leave them in. I'm just kind of going to turn this way. I think we're just going to add one guy in here on the jawline. Just to help those threads, if you're using multiple threads, seed into that area. There we go. Beautiful. Okay, so an integral part of doing a thread lift with, a brow lift rather with threads, is having a consultation with the client to make sure that you understand exactly what it is that they are seeking to do. Some folks, younger generations, tend to like what's called the fox eye. I'm sure you've heard of that, or the cat eye lift. That's lifting the lateralmost aspect of the brow here. Some people like to accentuate the arch here. Some people like the medial brow raise with the lateral. Everyone's just a little different depending on what their aesthetic is. So what type of look are you seeking to kind of raise?
You know, I really like that idea of this fox eye. I like that a lot. I think that's kind of what I'm looking for, but I definitely trust your judgment.
Okay, cool. So what we're going to do is we're going to place a thread not only here in the arch, but we're also going to place it in the lateralmost aspect as well, because we do want to raise about midway through the brow to the lateral end. Depending on the type of lift that we're starting to see, depends on which age rather we pick will kind of depend on how she's responding, but I'm anticipating using probably a 20, 21 mid-brow and then a 19 on the edge there. So when you're numbing, you do want to make sure that you are delivering the medication intradermally, and you want to see that little wheel pop up. Also a good idea to use lidocaine with epinephrine in this region especially, because it will help minimize on the bleeding, because it does bleed more in this area. Okay. When doing brow lifts is to put, after I place the lifting threads, I like to also place some smooth threads in between where I place the lifting threads. Reason being, it'll help create more of a sort of collagen scaffold in between those threads to make the threads over time last a little bit longer. Because with lifting threads in your brows or in your forehead, there's more movement. The threads lifts tend to not last as long for the eyebrows. I generally say with most patients 3 to 6 months on average, although everyone is a little bit different. Unlike when we're placing them in the mid-face or jawline, you get much, the longevity is much more. So I found that when I place a bunch of smooth threads through here, it does make the overall effect better and last longer. Maybe relax your head. And she should be pretty numb from this because we did place numbing along the track here. Unlike the Barb threads that are blunt, these are sharp. You can place all of them if you wish, and then remove them after you place them, or you can remove them as you place them, and it doesn't really matter. It's whatever you prefer. Okay. Smooth threads you can literally place anywhere where you want to strengthen the skin and build our collagen. Beautiful. Isn't that cool? Really neat.
Wow, that is really
And that's just
amazing.
one on that side.
Wow. So cool. Really awesome.
Alright, so I just placed the second thread. I just want you to kind of look back up at the camera here so they can see even the difference from one thread to two threads on this side.
Wow. So amazing.
Third thread, lateral brow. Now look at the difference.
It's so crazy.
Right?
I honestly did not feel that on this side at all. Like nothing. It doesn't feel painful. It just feels like the tiniest little,
Yeah.
and a little bit of pressure, but no pain.
Okay. So now I'm just putting what my practice uses, post-procedure, something in our private label line. It's Vitus that's really good for protecting, replenishing, healing, calming, soothing, all that stuff. But whatever you guys prefer to use is good. Relax your back. And I like to kind of just massage upwards. You can see that she's grimacing a little bit. It's not the funnest thing in the world to the patient, but it does help kind of just any of those remaining barbs that haven't fully engaged. It just kind of helps them engage into the tissue, which I like to do before they leave. Okay, so we just finished the threads on my lovely model here, and she wanted to pop on and talk a little bit about her experience. So tell me, how was it? Tell them kind of like start to finish.
So overall, it's totally worth it. I can already see some really beautiful results, and I'm super excited about it. I wouldn't say it's super painful. I would say you feel a little discomfort and maybe a little pressure, but it's not overwhelming, and it's definitely manageable. Right now I feel a little swollen, but I already feel like I'm kind of going back to a baseline and going back to normal. And all I feel, for the most part, my overwhelming sensation is just like lifted on both sides. That's how my face feels, and it feels like I got a refresh.
Yeah, which is exactly what we were seeking.
Yeah.
Okay, you guys, so this is perfect example of why I love Threads so much. She looks in the after photo so much better, yet so like not overdone, right? She just looks lifted, refreshed, rejuvenated, looks more youthful, doesn't look as tired as she looked in the before photo. You can clearly see that mid-cheek region, how that's really restored as well, which is amazing. And here you can see from a side angle, just how that really crisped out her jawline and really popped up her cheek, making her again not look so tired. Here, great before and after. If you look at that, so this is depicting the brow lifting threads. Look how much more space. Now we maintain that brow shape. We just kind of opened it up there at the lateral end, and look how much more wide awake. Look how lifted that is. It's awesome. She's so happy. I'm so happy. Perfect example of why threads are amazing.
Okay, people ask me all the time as a trainer, Dina, you love these threads so much. Like, where do other treatments, mainly filler, where do they fall in the continuum? Where do they fall in the plan of care for a patient if you're recommending threads? This is a good question and something that I can talk about for a long time, but I'm going to really shorten because I don't have a lot of time to talk. But I'm going to tell you that, it's important to have a lot of tools in the toolbox. All right. It's important to understand how to use and when to use each of these products and when to recommend each of these products. In most patients, at least the patients I see in my practice, but I can tell you amongst most patients in most practices, lifting, repositioning tissue with the Barb threads is certainly typically a mainstay. And it's usually what I tend to do most. People are like, oh, I think it's better to fill first and place filler and then maybe add threads after. That's fine too. Listen, everyone, there's no right or wrong way necessarily. It's how you feel comfortable and what you feel works best in your practice. Just because I do it this way doesn't mean it's the right way. Just the way that I find for me has worked best for me and has yielded amazing results. So I actually prefer to lift because what we're doing is people have, right, the weight, and if you think about how the skin and the fat pads, how we age and how the fat pads descend and fall, we're repositioning them, right? So we're kind of popping them back up this way to where they used to be when the client was a bit younger, okay? So they already have a lot of that volume on their face. A lot of the volume hasn't just like disintegrated and gone away. It's where it's descended, it's fallen, right? So we're repositioning that back to where it used to be or closer to where it used to be. So whenever the threads themselves kind of settle in, what I prefer to do is see patients back after a few weeks and then reassess and see where we could further fill in any volume deficiencies. Because in many, many cases, you will see yourself, if you did it this way, that a lot of these volume deficiencies were corrected by lifting and repositioning tissue. It's a really cool concept to kind of see how that works in your practice. In many cases, you don't even need to add filler at all. The filler companies will kill me by saying this, but it's the honest to God truth. Now, obviously, if we're dealing with someone with substantial gravity, with, someone that's more mature, there may be some, they work filler and threads work very well in conjunction with each other, but you don't always need to use filler in conjunction with threads. A lot of times the threads themselves are more than sufficient and yield a very, very happy patient and an incredible result.